Welcome back to the Arizona Daily Mix. Medicare open enrollment begins October 15th, and David Luna, founder and chief revenue officer of Connie Health, is joining us to share some top reasons to look over your Medicare plan, especially if you're turning 65, David, because there's a lot of information out there. But before we get into that, let's talk about what Connie Health is all about.
Yeah, thanks for having me, Brad. First of all, I've been in the insurance business for about a little over 20 years, and every time that I speak to clients and they want to make important decisions about healthcare, I find that there are so many options available. It's just overwhelming and sometimes even frustrating. So my partners and I founded Connie Health to empower seniors to make those decisions and give them confident, worry-free healthcare decisions. And so we're based here in Phoenix. And so with our local Medicare agents, we combine expertise in Medicare, and then we also combine the power of technology to help people make those decisions without having to worry about, where they're going to land.
Yeah, you said it right there, is that it is a lot to maneuver when it comes to our Medicare. I mean, even for younger people, but especially as you get older, there's so much that overwhelms them. And that's where you guys come in, as you just said. So let's walk through a little bit. Open enrollment, what does that mean? I mean, people wonder, like, well, am I already enrolled? What does open enrollment mean?
Yeah, a great question. So open enrollment is starting on October 15th through December 7th, and it's a time when people can make changes to their insurance plans. And so if you're on an insurance plan that you're not happy with, and for whatever reason, right, Brad, my doctor's no longer accepting the plan. I'd like to get some additional benefits. That is the time to make the change. And when you make those changes during that time, they become effective on January 1st of 2021.
So, okay, you said something very important there, and that's making changes to your Medicare plan, because there's a lot of stuff in there that we see, and also too, we're hearing rumors and stuff that kind of scare people, and that's where you guys come in to break it down, right?
Correct. So our Medicare agents are here locally, so we understand the landscape, we understand the options that are available here locally, and then we also are in the community as well. So we understand, people wanting to see their doctors. We understand, the comfort somebody gains with, let's say, for example, a cardiologist that's helped them. And so, we combine all of that expertise, we combine all of that experience along, again, with our technology, and are able to help people find the right plan for them.
Oh. All right. COVID has really pushed things around, has gotten people a little worried, different things. But here in Arizona, I like what you said, that you know what's going on here, because we have a lot of people who come from other states here, and actually during the wintertime, they work on their Medicare and their medicine here. So how's that working for you guys?
Well, COVID-19 has definitely put a damper on several businesses, right? And so it's top of mind for Connie Health. And so what we do is we practice, obviously, the safety protocols, social distancing, we wear a mask. Believe it or not, Brad, there's a lot of people that still want to meet in person. So for those people, we do practice safety protocols.
So, okay, before October 15th, give me a couple of myth busters, and then we'll talk about some things we need to prepare ourselves for. So first, let's do the myth busters. What's some of the things that are untrue about this open enrollment?
Open enrollment. So number one, October 1st, we are able as agents to speak about the new 2021 plans. However, we're not able to enroll people until October 15th. So a lot of people give us a call and say, hey, I want to enroll now. And really, we're not allowed to enroll or take an application until October 15th. So that's one thing. The other myth buster, I would say, would be it's not necessary to make a decision right on the spot. Take your time. Let one of our advisors talk to you. We're experts at listening on what you need. So every plan, although there are 60 some odd plans out there in the market, every plan is for each individual. So a plan that may fit you may not fit somebody else sitting next to you.
Got it. Okay, what does a service like Connie Health cost for someone looking to make sure their Medicare is okay?
Yeah, it's absolutely free. So our services do not cost any of our consumers or any of our members anything. So please give us a call. We'd love to talk to you. And again, it's absolutely free.
Okay, David, why would someone want to talk with Connie Health at this time and open enrollment?
Brad, great question. There's so many plans out there. I think I mentioned earlier, there's about 60 plans out there in the market right now. And no plan is the same, right? And so we want to make sure that you as an individual are on the correct plan or on the right plan for you. For example, your current plan may not have your doctor any longer, or your doctor may not accept that plan. We want to make sure that your doctors, number one, are covered. We want to make sure that your drugs are covered. We also want to make sure, what's important to you. Do you want a plan with a free gym membership? Do you want a plan with, dental care, vision care, hearing care? So those are all the things that we want to make sure that we know about you before we decide to make any type of decision on on any healthcare plan.
I like that. All right, David, again, tell people how they can get a hold of Connie Health. I know you just said the number right there. We have it on the bottom of the screen, but people also like to hear it too.
Yeah, please give us a call at 623-223-8884. Or you can also visit our website at www.conniehealth.com.
All right. David, thanks for joining us. And I kind of feel a little bit more comfortable knowing a little bit that I need to look out for even my Medicare, but again, also for my mother's too, which, she's in that age group. So I appreciate it, David.
Thank you very much. Appreciate it. Thank you, Brad.
Yeah.